So in this video we're going to cover the colony stimulating factors, and specifically we're going to cover the Epoetin Alfa. So there are two different types of colony stimulating factors. One is Epoetin Alfa and another one is filigristim and sarcomostim. This one is for RBCs, that means red blood cells. This one is for white blood cells. So whenever you give this one to Epoetin Alfa to patient, it increases the red blood cells count, and these two are used to increase the white blood cell counts. Let's talk a little bit more about the Epoetin Alfa. So whenever in our body there's a low red blood cells, what happens? A kidney is a really important organ, but that senses the low red blood cells in our body, and it releases what's called erythropoietin. Now this factor will go to the bone marrow and tell bone marrow, hey, we have a low red blood cells, we need to produce more. So the bone marrow will produce more RBCs. Now what happens if someone have chronic kidney disease, CKD? What if someone has a kidney failure? And what if someone doesn't have a kidney at all? No kidney. What will happen? The kidney cannot, if there is no kidney or kidney disease, it cannot sense the low red blood cells. Then the bone marrow will not be able to produce more red blood cells. In that case, we give this Epoetin Alfa, and Epoetin Alfa will stimulate the bone marrow instead of erythropoietin to increase the production of RBCs. So it's basically given for patients who are a chronic kidney patient and they have a low red blood cells. Like for example, for the treatment of anemia, could be associated with anything, like patient can get anemic if they have kidney problems or for some other reasons as well. So we need we can use this Epoetin Alfa to increase the red blood cells count and for the treatment of anemia. Anemia caused by the chronic kidney failure, as we talked, and a patient with HIV and receiving antiviral medication. And the reason that they give this medication for the patient who's receiving antiviral medication is most of the antiviral medication will cause the low red blood cell production. That's one of their side effects, and in order to overcome that side effects, the patient will be on Epoetin Alfa to increase their red blood cells. And also in patient who's receiving chemotherapy, the chemotherapy decreases the white cells counts, red cells counts, platelets. So to increase the red blood cells in a patient who is receiving chemotherapy, they'll be receiving Epoetin Alfa at the same time to maintain the red blood cells count. Alright, and the side effects for this medication, Epoetin Alfa, is headache, high blood pressure. It can cause the joint pain and skin rashes. Mostly skin rashes because like if they're allergic to it or if they have some kind of reaction to this medication. Mostly this medication is given as a sub-injection either in IM or sub-Q, and it's given like every week. It's not like a daily medication through the injection. This is a short video. Sometimes they ask these questions, and NCLEX is a really good drug to know as well if you're working on some floor where they're doing like more kidney transplant, like that kind of procedures. Then the patient will be on this medication. You'll see the patient on this medication very often. There was a short video about the Epoetin Alfa. If you have any questions about this medication, feel free to ask us, and thanks for watching it. Thank you.